Olá a todos, boa noite. Vamos começar mais uma palestra aqui do evento. Meu nome é Aline, vou ser mediadora dessa palestra e vamos ter como palestrante o professor Jay Sean, e a palestra tem como título Emerging Issues in the Ethical Governance of AI for Health. E apresentando o nosso palestrante, ele é professor assistente no Departamento de Fisioterapia da Universidade de Toronto, tem uma nomeação no Instituto de Política, Gestão e Avaliação de Saúde, onde supervisiona estudantes de pós-graduação com foco em pesquisa. Além disso, ele é diretor de pesquisa de inteligência artificial, ética e saúde no Centro Conjunto de Bioética da Universidade de Toronto. Também é cientista adjunto no Women's College Hospital Institute for Health System Solutions and Virtual Care. Ele atuou como fisioterapeuta em cuidados comunitários antes de concluir o seu doutorado em 2012, e a sua linha de pesquisa aborda a implementação e as implicações éticas das inovações nos cuidados de saúde, com foco especial em modelos inovadores de cuidados integrados, focados na comunidade, tecnologias de cuidados digitais de saúde e aplicações da inteligência artificial nos cuidados de saúde. E agora apresentando o palestrante em inglês, Jay Sean is an assistant professor in the Department of Physiotherapy at the University of Toronto. He holds a nomination at the Institute for Health Policy, Management and Evaluation, where he supervises graduate students with a focus on research. He is also Research Director of Artificial Intelligence, Ethics and Health at the Joint Center of Bioethics at the University of Toronto, and he's adjunct scientist at the Women's College Hospital Institute for Health System Solution and Virtual Care. He worked as a physiotherapist in community care, and his research program addresses the implementation and ethical implications of innovations in healthcare, with a special focus on innovative models of community-focused integrated care, digital health technologies, and applications of AI in healthcare. Be very welcome, Professor. You may take it from here.
Thank you. Hello, everyone. Wonderful to be here today. Thank you all for tuning in. I guess I'll share slides again.
Yes.
Oh, there we go. Perfect. So thank you, Alina, so much for the introduction, and wonderful to have the invitation to be here today. I was disappointed it couldn't be in person, but of course the virtual conference allows many more people to attend, which is fantastic. So I'll just begin, Alina?
Yes, please.
Okay. So I decided in preparing the presentation for today to change the title from what Alina has introduced to Big Questions for AI Ethics in Health. And that's because I've decided to frame much of the sort of core contents of the talk in terms of questions that I think will spark deeper thinking and ideally dialogue about the ethical issues surrounding AI as used across both healthcare and public health. So I include references to both of these kind of broad health-related use cases in the talk. And I wanted to start out by just sharing a reflection. I mean, of course, bioethics as a field, addressing AI as an emerging technology has been an extremely important concern over the past several years. And in the conversations that I've had with bioethicists around the world, there's a concern around developing the right kind of literacy or expertise around the technology to do meaningful bioethics work. And I would say that the way that I approach this topic is from a perspective of having expertise in healthcare and health policy, ethics and social science, but with what I would call a sophisticated lay understanding of machine learning and artificial intelligence, by which I mean I'm not a computer scientist, but I've taken it upon myself to come to understand the issues associated with building, deploying, and governing AI technologies for use in healthcare and public health. So, certainly that's possible to do. And certainly I think it's something that it's incumbent upon bioethics as a field to engage with in meaningful ways. So I commend you all for taking it as an explicit focus in this conference. So to outline the remarks, the talk that I'll be giving today, I'll start with a little bit of context, talking about AI and the longer term, sort of the 40 to 50 year time frame, and the implications for public health practice, but also for the challenges that public health faces. So I'll start with some comments there. And then I raise questions in these 4 different domains. First, data quality and governance. Second, power control and benefit. Third, matching solutions to problems. And fourth, understanding impacts. And I'll conclude by talking about directions for governance. So I'll say a bit more about where these ideas come from as I proceed through the talk. And I'm happy for these slides to be shared in PDF. So if you're taking notes, then I would say, don't worry about taking extensive notes. You can have these slides in PDF after the talk. So I'll start by referring to this book, Power and Prediction, which is written by 3 economists. And these 3 economists have written an earlier book called Prediction Machines that provides one of the nicest descriptions of AI technology to a general audience that I've seen so far in my career. And they're economists, so they're writing for a general business audience. That earlier book is from 2018, so it's a bit outdated at this point, but the core ideas remain very relevant. So they've written a follow-up to that book, the one I'm talking about today, Power and Prediction, where they're talking about the economic impacts over time that AI is likely to have. And in this book, they're comparing the reality of the state-of-the-art AI systems, the new frontier emerging systems, with the infrastructures, the social systems into which they're going to be embedded. And so they pose this question: which industries and organizations are ready to use AI? We have these, amazing machine learning AI technologies being developed, but which industries are actually ready to take that on board? And it turns out, based on their analysis, not that many organizations are prepared. They use this great analogy to electricity and the electric light bulb, or electric lighting in the United States. So famously, Thomas Edison invented the light bulb in essentially the late 1880s. And they track, or drawing on the secondary data, show how it was essentially 40 years until household electric lighting was made available across the United States. So the x-axis of this graph is decades from 1880 up to 1950. And the y-axis is the percent of houses in the United States that had the adoption of electricity. And you can see there's a solid black line there, household lighting, that shows it took about 40 years from the time of the invention of the light bulb through to its distribution and deployment across households. Now, the point they're making here is that between 1880 and 1930 is what they call the between times. So what happens between invention and widespread use? And they're saying that there's a whole host of infrastructural realities that need to be put into place in order for this particular technology to scale. And they say the same is true of other kinds of technologies. So they're using this as an example to say, when it comes to artificial intelligence, we're in the in-between times, because these great frontier innovations have been developed, but until they can be used in a meaningful, widespread way, there's this period of time where the systems and the infrastructures need to catch up. So I've done some work on this topic. There's a screenshot in the bottom left of a paper published with one of the authors of this book, addressing some of these issues around how institutions in healthcare will need to change to really take on these technologies. Now, my take on this is that we then have a distinct period of time where we need to address a number of ethically charged controversies if AI is going to work. And I think we've seen, instances all around the world where large corporations or collaborations have not deeply enough considered the ethical issues associated with these technologies, and it's come back to bite them in the end. So we have a period of time, the between times, and it's incumbent upon us to address these controversies. So I want to say a little bit about how we're thinking about AI in relation to healthcare and public health. And I will be talking about this paper that I'm showing in the top right of the screen quite a bit throughout this talk. That paper is a report on a World Health Organization sponsored event called the Global Forum for Bioethics and Research. And a couple of years ago, this was hosted in Cape Town, South Africa, and brought together bioethicists from all around the world to engage in dialogue about research ethics as it relates to artificial intelligence for health. And we framed that meeting, that forum, by understanding AI in two distinct ways. And I think it's a helpful way of thinking about this. So AI for discovery versus AI for intervention. Now, AI for discovery is the application of AI technologies to generate new insights, right? For example, in drug discovery. It's a domain that has a far lower risk to humans because it's informing a human process of creativity and development. So AI for discovery has a particular set of ethical issues associated with it that are distinct from AI for intervention. So AI for intervention, some examples include like automation of a robotic system, but also something like clinical decision support. So generating prediction through an AI technology that provides a suggestion to a clinician in the course of care. This is AI for intervention, doing something in the course of healthcare and public health delivery. So I'll be referring to this piece of work a fair amount. Now, certainly in my thinking about this, I see the immediate potential value of AI for public health and for healthcare. And it includes things like clinical decision support, chatbots to provide accurate health information, enhancing the efficiency of paperwork and bureaucratic processes, documentation, making predictions around disease spread and so on. So there's a wide variety of valuable use cases. And stepping back from that for a moment, I also see that particularly generative AI and these more recent advances in the technology will shift social structures. And I show here a screenshot of a paper with a large international group of authors where they looked at the impact of generative artificial intelligence on socioeconomic inequalities through its impact in a variety of different industries. And they suggest that inequities will grow. And this makes sense because those corporations, groups of people that currently hold the resources and capacity to build and use generative AI for benefit will do so. They will use generative AI, and that will lead to further resources and further wealth and so on. And as a sort of fact of that, over time, inequities will widen. So that is an important way that AI will actually shape the challenges that public health needs to address. If public health care systems and public health as a distinct kind of system have a mandate to address health inequities, then this is an important reality that will be shaped by AI as well. So back to this paper from the Global Forum on Bioethics and Research, there are two key pieces from that paper that I'll address during the talk. This first bit is about 4 themes that arose through the dialogue there that I think resonate well in international experience. So I'm going to talk about those and then reframe many of them as a set of questions that I hope you can all take away, that I think are questions for us as bioethics as a field to reflect on. And then the latter part of that paper, I'll be bringing up when I talk about governance near the end of the talk. So here I'm just providing an overview of key themes from the forum. The first is around the appropriateness of building AI in the first place. So there was good discussion here around moving away from this notion of technological solutionism. And I'll come back to that later in the talk, so I won't elaborate too much now. The second is around the transferability of AI models to new contexts. So if there's an AI, a clinical prediction model that was developed using data from Boston in the United States, how well does that apply to somewhere, to any Brazilian city? There's risks here associated with phenomena such as model drift, where the performance of the model changes as new data are fed into it over time. So this raises a host of issues about whether and how AI models can transfer to new places. Third was around accountability for AI decision-making and outcomes. And, I'll say that opinion on this particular topic is split. Some people think that we're still too new in the world of developing AI to assign clear lines of accountability, whereas others say we need those lines of accountability now to prevent harms that are likely to occur without them. And then fourth and finally was around the evolving nature of consent, and specifically how we may need to think differently about individual consent. What does it mean to provide consent for one's data to be included in an AI model, or for an AI model to be used in the course of care that's delivered to you as a patient, for example? So there's a wide variety of different models for consent that are emerging now, and certainly I think warrant a great deal of attention from the bioethics community. So, I shift here now then into a set of questions, and my intent is that these questions prompt continued and deeper reflection on some of the issues that I've already raised. So the first kind of set of questions here is around data quality and governance, and specifically two questions. What is the quality of the data, and who decides how the data are used? So in relation to data quality, I think to an example like social media data. And social media data can be used to great benefit around things like identifying mental health crises or predicting suicidality. But at the same time, social media data comes with its own information context. People behave in a particular way when they interact through social media. Gaining access to that data, even though it's being posted publicly, introduces a unique set of ethical issues. So social media data presents one particular kind of ethics issues. The screenshot I'm showing here is from an article from a researcher named Taylor Cruz, who uses ethnographic methods to study how data are collected in the first place. So here, this is a paper where she's done an ethnography of the collection of race, sexual orientation, and gender-based data in what are called safety net hospitals, hospitals for people who can't otherwise afford health insurance in the United States. And the point here is that there's material and political realities. It's very messy to collect that data in the first place. So if those are the data that are being fed into AI models, what's the degree of trustworthiness of the model when the data itself has these fundamental questions about its quality? Then in terms of who decides how the data are used, here I show an image of a paper that I've published with a colleague of mine in the UK, building out this concept of health data justice. And in this work, we're asking, how can health data be used through AI and other means to support a health equity and a social justice agenda? And one of the points we make here is that it's not only about making decisions about which technologies get built. It's also about shining a light on the institutions who collect the data, the the hospitals, public health entities, corporations, and posing the question, what is the relationship between these institutions and communities that have been historically marginalized? And what needs to be done differently in order to earn that trust? Because if those communities are giving data over to these institutions, that can only happen in the context of trust. Currently, that's not happening. And I do believe we're going to see more immense resistance to these practices, which of course is already happening sort of across the world. So on to the next set of issues. I've referred to this one as power, control, and benefit. And it's, for me, sort of about who's in the driver's seat, who's moving these technologies forward and therefore also benefiting from them. And that's the third question that I pose here. Who benefits from building AI, both directly and indirectly? And in response to this question, I think, of course, there are ways in which providers and patients do benefit from these technologies, where services are able to be delivered more efficiently, more smoothly, perhaps more effectively. Then, of course, there's direct benefit that accrues, develops to patients, providers, communities as well. But I would also point to the fact that, I learned this recently, was surprised to learn that 6 out of 7 of the largest companies in the world by market capitalization are technology companies headquartered in California in the United States. So that's an immense concentration of power and wealth in that particular region. And that is something that sort of demands deeper attention. I show here some work by a researcher in the Netherlands, Tamar Sharon and her colleague, exploring the impact of the big technology industry as they begin to make their way into healthcare more strongly. And she points toward the realignment of the way that healthcare works with the logics and approaches of corporations. She points to this as a harm that might be a bit more difficult to see, but is going to produce returns to big technology companies that are not necessarily seen in the health sector. So larger returns to big technology firms as opposed to public health and healthcare institutions. And I raise this simply so that we can see this context with more clarity, that there is an immense concentration of power and resources driving the development of these technologies, and that the benefits that accrue from using the technologies also come back to these technology companies. So on to the fourth question here, who controls the AI resources? I mean, certainly these ideas are closely linked to what I've just shared. But I would also say, recently, I've done this work with an international group of authors on the idea of the digital determinants of health. And we looked at this question of who is included and who is excluded from the design and development and use and governance of these technologies. And when you look at the concentrated nature of resources on these topics in particular regions of the world, it raises the question, what about everyone else? And I show this image. This is an image that was developed in the course of doing that work, where we acknowledge that there's inequities in power and resources, and that means vast swaths, many people in the world are excluded from these activities, design, distribution, use, and governance. And that drives continued divides, the digital divides that we see in the world. So again, this is a very high level, but very important observation from an ethics perspective, in my view. So on to the next sort of topic area around matching solutions to problems. And I introduced earlier this concept of technological solutionism. Mentioned, introduced by a commentator, a technology critic and commentator, Evgeny Morozov, more than 10 years ago now. It's this idea that people look to solve problems with technology first. And there's a deep critique of that approach to thinking about problem solving. So the questions I pose here, do we really need AI for this? And what do communities, patients, communities think about AI? Now, in terms of the first question here, do we really need AI for this? I think in one sense about a project that I'm currently working on with some colleagues in Toronto, and that's the screenshot on the left, AI for diabetes prediction and prevention. And with this project, we've developed these models to predict the onset and complications of type 2 diabetes in a very diverse region of Toronto that has a very high proportion of newcomers to the country, newcomers to Canada. And we're working closely with public health and with community agencies to focus in on very local planning to identify where the need is and build services locally to address that need. So in my view, this is an example of where AI is genuinely helpful. It allows for the better use of resources through more targeted neighborhood planning. But at the same time, I acknowledge the insights of this other work from, for example, a scholar, Cheryl Holzmeier, who points toward social transformations, not technology, as strategies to promote health equity. One of the examples she gives in this piece is that AI technologies cannot solve the housing crisis. And the point being, we can't give it all over to technology. Sometimes community organizing and good old-fashioned political advocacy is necessary to produce the kind of changes and kinds of investment that we need to take action on things like advancing health equity. So the latter question here, what do communities think about AI? Here, two important pieces come to mind for me. The first is around AI literacy. What do communities, what does the general population of Brazil know about artificial intelligence? And this points to what I see as being a sort of urgent public health intervention to mass educate people around the world about what AI is, how it's built, what it can do, and what it cannot do. Because we ask this question, what do communities think about AI? I mean, that rests on the assumption that communities know what AI is. There was a study published where they surveyed people across 30 countries earlier this year. I haven't included the reference for this here, but it was published by an institute that's located at University of Toronto, where they found that people in countries around the world had a relatively high confidence that they understood what AI was, but reported very little knowledge about outputs of AI, like deepfakes. A deepfake is a fake image or audio or video that's been generated by AI. So this is, of course, a major issue. Literacy. What do communities know about AI? And that, is closely connected to the screenshot here of an article that's just one of a few toolkits, I would say, that about how to collaborate with and include community members in AI design and development. So this knowledge is coming. It's being developed now. It's really only in the past few years that this work has been done, but it's also extremely difficult to do. It takes an enormous amount of time to build relationships with communities and establish that trust such that community members are providing meaningful input into what you're trying to do. But I would suggest that the role of communities in the governance decision-making around AI is a fundamental next step. And that will come back later in the talk as well. So on to this kind of final section of questions around understanding impacts. And here I'm talking about, of course, benefits and harms of AI, but also hidden benefits and hidden harms. Hidden benefits could include things like, for example, if it's the case that a public health unit could use AI to save resources and then reinvest those resources into a new program, that would be a hidden benefit, something that's out of view of the evaluation of a particular AI project, but that is beneficial to public health in the longer term. Now, I think we know, and I think it's a sort of a shared universal experience, that that's not how public health is resourced. If public health is able to save money, then that's usually because there's budgets being cut. And that's something that we need to be aware of, because there needs to be strong human resources for healthcare and public health into the future. But the thing I want to talk about more here is about the hidden harms of AI. And there is an emerging body of research that very explicitly attends to this. What are the harms that come from AI technologies that are a bit more difficult to see? One example that's raised in this paper is around the climate impacts. And the Guardian newspaper in the United Kingdom recently published a piece about how big technology companies had been lying about the climate impacts of their work. So that's an example of a hidden harm. And these harms can be networked and sort of build over time. So paying attention to across the whole supply chain and the whole process of building AI technologies becomes important. And then eighth and finally is this question of how AI should be governed. And I point toward this notion of collaborative governance, which is, essentially the idea that we need to step back, look at the ecosystem of all of the people involved, not only in building and using technologies, but the people who are affected by them, and find a way to work together toward achieving the goal of AI technologies that have a meaningful impact in healthcare without having some of these secondary harms that can be really damaging to communities over the longer term. So one of the sort of key ways of reframing governance through this approach is to see it as a process, not as a set of structures. So I'm going to sort of shift into the concluding parts of my talk by elaborating a bit more on what this means for governance. So I'm back now to this paper on the Global Forum for Bioethics and Research, where we identified a set of issues. I've framed some of those as key questions to deepen thinking here, and now want to talk about what are some sort of core ideas that can be built into an approach to ethically govern AI technologies in health. And there's a lot of content here. I wasn't sure that I should include it all, but ultimately what I've done is put these sort of core points over 2 slides. So this next slide has a lot of information, as does the subsequent one, but I think it's better to just get this information out. You can have these slides, as I mentioned, as a resource afterward, and then we'll see if there are questions or comments that come up. So collectively at that meeting, we came up with a set of recommendations for what we called, in that instance, governance actors. So this is not just policymakers, it's not just data governance committees, but it's broader than that. It's the leaders of initiatives, it is policymakers, it's community leaders, working together to achieve these governance goals. So firstly, we said remain up to date on recent advances in regulation of AI for health. And of course, this is a topic of immense interest around the world. People are doing a huge amount of work on this, and there's been real leadership, in jurisdictions such as the European Union. So we see different kinds of policy approaches to AI emerging around the world. We see a consensus around medical devices, AI that actually intervene in clinical care. But it also leaves this enormous gray area around health and wellness applications and health promotion applications that involve artificial intelligence, but are not regulated by any specific kind of policy in many jurisdictions around the world. So what's happening around the world? How are these gaps being addressed? Second is around a focus on ethical governance of data. And I really fundamentally believe that data are the foundation of artificial intelligence models. And if you ethically govern access to and use of those data, then you will promote the development of ethical AI models. So beginning with ethical data governance is a really important starting point. Third, incorporate AI impact assessments. So there is an emerging practice and a number of toolkits available for free download online on AI impact assessment. And this is about understanding the near-term sort of evaluation of the impact that AI technologies are having in practice, but then also thinking about the longer term. Is there stigma growing for particular groups, for example, as a result of these technologies? So thinking systematically about AI impact assessments or algorithmic auditing is a really important part of this broader vision around governance. Fourth and related is around environmental impact assessments. I mean, this certainly is a shared mission of deep importance to the entire world, and is something that all sectors need to be paying close attention to. So, as we are devoted to the public's health, attending deeply to the environmental impacts of these technologies is really important. Finally, for this section is around promoting transparency in AI development. And the notion of transparency has occupied a lot of attention in AI dialogue. The sort of core conference around the ethical deployment of models is called Fairness, Accountability, and Transparency, the FACT conference. And the question also then sort of becomes transparency about what? Transparency about the data that are used, how the model is developed, how resources were obtained to build the model, who the customers are. Like, transparency can mean many different things. And in the context of healthcare and public health, particularly in global health, transparency throughout that entire pipeline is immensely important. Okay, so it's sort of second and final slide around these governance recommendations that came from this paper. First one here is to promote community engagement across the phases of AI development. And I'll clearly emphasize as I conclude the talk that this piece of community partnership, getting that right is, I think, the central pillar of ethical governance for AI into the future. From a global health perspective, encouraging fair partnership between researchers and organizations in different jurisdictions. I mean, there's a central element of global health justice here, in addition to justice for these projects involving AI. Third, explore new forms of experimentation in policy for AI. And we've seen there's something called a regulatory sandbox. So companies or entities that are building these technologies will approach a government to say, we have a technology. Instead of doing this old pathway, we'd like to try a new pathway. Let's work together to learn about what a regulatory pathway for this kind of technology might be. And those have been used to some success internationally. Finally here, evolve the structures and capabilities of governance functions. And there's been quite a lot of writing about, for example, research ethics boards or institutional review boards. What kinds of expertise do they need? Where do they sit? Do we need an AI ethics board that functions not only for research, but also for the procurement and deployment of these kinds of technologies? So thinking a bit differently about the current structures and capabilities we have for governing science and technology, and how those may be extended or evolved to meet the needs around AI. This is an image of the Canadian federal government and other entities that are involved in the governance of AI here in Canada. And I'm not going to go into this in any detail. I simply show this to say it's very structural. It's very difficult to see how there's a process embedded here, and it's very difficult to see how community is or is not involved. And to me, the sort of bottom line here is that there's no place for the community here. There's no obvious place for the community. So thinking differently, flipping this on its head and thinking about the collaborative process, collaborative governance of AI for health is, I think, the sort of next frontier around ethical governance of AI for health. So final slide here, finishing up about 5 minutes early. So I've reviewed the context, my thinking about this being in the between times in AI for health, and that we have this opportunity now to address the kinds of controversies and tensions that I've raised here. We talked about a number of questions raised related to data quality and governance, power control and benefit, matching solutions to problems, and understanding impacts. And we concluded with ideas about future directions for governance, and specifically the role of communities in collaborative governance. So with that, I'll say thank you so much for your time. And Alina, I'll look to you for some conversation and sharing if there are any questions. Thank you.
Thank you very much for your excellent lecture. We are going to check if we have some comments or questions and hand it back to you. Okay, we have a comment of Professor João Almeida. He says, thank you, Jay, for being with us and presenting such an important topic. Any questions? We have a question here. Good evening, Professor. I would like to know if in your opinion, what role legislation plays in regulating the use of AI technologies in healthcare and how it can evolve to keep up with the rapid advancements of technology?
Yes, thank you. Well, firstly, thank you, Professor Almeida, for the invitation to be here today. It's a thrill. And to this question, I think this is a really important question. It's well placed. It's a good one. And when it comes to AI policy, I would point to two very different policy regimes. Now, I don't know the legislative environment in Brazil when it comes to medical devices, but I do know of there's a regulatory consensus in the United States, Canada, Europe, and Australia around how medical devices are regulated. So there's a class-based system. There are four categories, each one representing a higher degree of risk. And these are specifically for medical devices. So software as a medical device, where a medical device is classified as some kind of software technology that in some way directly intervenes in clinical care or a human's physiology. So an example is closed loop insulin monitoring systems for people living with diabetes, where there's an AI component to help regulate insulin in the body. That's an extremely high risk device. And so that would go down the medical devices pathway. Even an add-on into an electronic medical record that provides specific advice or specific direction around treatment pathways could be viewed as a medical device by some regulators. And that I'll call the medical devices pathway. That pathway comes with a well-defined set of approvals and ongoing monitoring that's required for those devices to be eligible to be sold in a particular jurisdiction. So there's now, the way that pathway is implemented is on a volunteer basis. So companies that have a technology come to the regulator and say, I want to sell this product in this country. Can you please approve this? And they submit a whole bunch of paperwork and evaluation outcomes and so on. So that's a well-established pathway for software as a medical device. Elsewhere, though, so for social media technologies that clearly have an impact on health, exercise tracking applications, things like mental health chatbots, and so on. They're not considered medical devices intervening in the course of clinical care. And as a result, they're not subject to that kind of regulation. They fall under a patchwork of other kinds of policies. So what we've seen in the United States, for example, is that it's actually the Federal Trade Commission there, which is like essentially responsible for economic and trade policy, that has fined a mental health chatbot, mental health online application for selling data from customers, even when they said they wouldn't. So you have a policy function in the US that wasn't designed to regulate health, AI for health, but has been used to do so. So, I mean, this is where what I consider to be like the Wild West of policy for AI is where we have health information protections, competition policy, human rights law, all these different, a patchwork quilt of policy addressing a huge amount of AI technologies that don't qualify as a medical device. So it's quite a complex landscape. And I think the strategies for addressing this sort of Wild West of AI technologies, the European Union is trying to do that with a single AI legislation. Other countries will not pursue, a comprehensive AI legislation like that. So, your question then, how can it evolve to keep up with the rapid advancement of technology? I mean, one of the key points that I've sort of observed over the past couple of years is that even where it's a patchwork of policy in different jurisdictions, if a government is committed to holding AI technologies accountable, they will do so. They will find ways with their existing policy functions. I think certainly AI policy needs to evolve, but I don't think we're done seeing the directions that AI technology itself is going to go. There's been so many advances over the past 5 years in particular. I think it would be difficult to properly keep up. So I think policy itself will need to be nimble and evolve quickly, which is another challenge of our time. Thank you for the question.
We have another question from Professor João Almeida. When we talk about the use of AI in healthcare, we often mention resource savings and reduced staffing costs. Do you think this will also lead to improved quality in healthcare service and equal access, or could it result in the creation of two healthcare systems, a high-quality one for the wealthy, and a lower standard AI-driven system for the underprivileged?
This is an excellent question. And I was just speaking about this earlier today in relation to public health, where organizations procure, buy, and deploy AI technologies with the idea that they can replace the work done by people, there will be problems. There absolutely will be problems. And so my suggestion in response to this earlier was that somebody needs to be documenting those cases where people have fired staff, removed staff, and brought on technology, and then ended up going back and hiring the staff back again because they realized that the technology cannot do it. And in fact, this is an instance where I do think that AI technologies can enhance capacity, but they require people with expertise to maintain and deploy them properly. So it's not, I don't see it in the short term, it's not a resource saver. It will add costs in order to perhaps save costs in the longer term. But the other thing is that, in my health policy training, we learned that if you build a new wing, more rooms in the hospital, they will get filled. If you build new lanes on a highway for cars, there will be more cars on the road. Healthcare is demand inducing. So when you become capable of doing more in healthcare, you realize there's a whole bunch of health-related needs out there that are not currently being met. So, you induce demand for more care because you have greater capacity to provide that care. So, I think that's a real risk that you point out, and it's something that we need to be documenting and talking about to prevent precisely that, removing staff by bringing on AI technologies, which will not work, in my view. Thank you. Great question.
We have a comment from Charles Vieira Fonseca de Almeida e Daisy Ferreira Fernandes Paz. Congratulations on the lecture, Professor. It's a very relevant topic today.
Thank you. Thank you.
I guess we have no more questions now. So, no further questions. We may conclude. If you have any additional remarks to make, be our guests.
Just to say thank you for attending, and feel free to reach out if you have follow-up questions that occur to you. So thank you for attending.
Thank you very much. And once again, it was a pleasure having you here. I hope you also enjoy it, and we are looking forward to catching up on your research and scientific contributions. Have a great one, and feel free to enjoy the rest of our events.
Thank you, Aline.
So that's it.